Hello, everyone. Today I am going to talk about mother child healthcare paradigm. As you know, mother child healthcare is one of the primary focuses of the effective coverage in healthcare policies. My interest in this very short presentation is to emphasize on interdisciplinary paradigm of mother child healthcare needs, uh, connecting medical, psychological, social, and cultural context of mother child health. Uh, First, let us see the medical perspective. Medical care represents a highly technocratic model of physical well being. The concept of the technocratic model was probably first used by Davis Floyd in the context of childbirth. In reproductive physiology, the reality of the human body is a technocratic construct and human is an object. A young child is a physically immature human becoming and an absolute dependent human body. An expert centered physiological exploration determines the planning and implementation of a quality healthcare system for young children. Hence, there is a universal conceptualization of the human body that is institutionalized by the physicians and the medical professionals, and they drive the globalization of developmental goals to ensure healthy lives across the globe. In this context, usually the numerical definition of the child determines the developmental status, developmental markers, and the needs of the child following the numerical age. Uh, in psychological perspective, in the 20th century, the widespread psychological models of childhood and natural mother-child attachments they influenced child care practices in the post-war Western societies. Very famous ball-based mother-child attachment theory. It significantly influenced the mother-child health and well-being needs. He believed that the mother infant attachments have a tremendous long lasting impact in improving the child's survival and well being. On social and cultural level, postpartum mother child care practices contribute to several social processes that emerged as socially supportive phenomena for the health of a mother and the child during this vulnerable time period. In several societies, this postpartum period is traditionally named and it includes belief practices related to healthy nutrition for the mother to produce good breastfeed, and then breastfeeding belief practices, and then at home rest for several days. In most of the studies that report mother child dyad, during postpartum care, there is a focus on these belief practices for mother and child care. Now, if we see World Health Organization WHO health guideline, the quality of care standard emphasized on two perspectives. First, the woman's positive experience of pregnancy, birth, and postpartum motherhood is based on women's values in their context. Second, uh, it should include community participation and women voices in the planning, implementation, and monitoring the healthcare system. In line with these recommendations for quality of care standards, the adherence to providers' instructions requires a contextualized body of instructions that should reflect a shared understanding of the human body and health needs. So, overall, uh, the medical, physiological, social, and cultural perspectives on mother child care are different means to an end, and definitely to achieve mother and child well being. So, there may be different approaches and perception towards mother child health needs that should be studied in interconnection to each other, and there should be a more holistic and contextualized approach. For example, in medical perspective, body is an object, and usually reality is a technocratic construct. In psychological perspective, reality is a psychological construct, and human is a subject, but it is a developmental exploration of the human body. And in sociocultural perspective, reality is socially constructed, and humans contribute to this reality as a social actor. So the contextual exploration is more important. Then I feel there should be a triangulation of these three theoretical constructs about the mother and child's health needs. In connection with human body and health needs, it is also important to understand how social and cultural beliefs and practices situate mother child health needs and possible healthcare practices. Therefore, I move ahead of a technocratic perspective on the human body and emphasize on the sociocultural perspective that conceptualizes human world realities as socially constructed and mother child health as an interdisciplinary paradigm. And this interdisciplinary paradigm is comprised of medical, psychological, and sociocultural components of health needs. Despite the universality of physiological aspects of mother and child health, pregnancy, birth, and postpartum experiences, they are not universal at all. And they involve a wide range of emotional, spiritual, social, and religious aspects. Human health is more than a medical art now, and human seeking behavior is closely connected with their health needs and healthcare awareness. Hence, I see medical, psychological, and sociocultural aspects of our health related awareness as received, perceived, and internalized awareness, respectively. With my ethnographic research experience, I assume that a need based survey may not help in improving the healthcare system, effective coverage, and expected positive outcome unless the health needs are not contextualized with the evidence based analysis of human health seeking behavior in specific cultural context. This social and cultural context is multi layered, and each layer is a layer of interconnected meanings. Addressing this gap can help to increase the culturally supported adherence. Hence, a formative research design incorporating interdisciplinary triangulation of these theoretical perspectives can provide better insight for intervention and effective coverage. Thank you. I hope this short presentation may be helpful in your study and research on mother child healthcare needs. Stay connected.